Now, let me introduce to you our new president of the ATA, Reed Tuckson.
Thank you. Let me very quickly, we know that there are a lot of things that you need to do, and I will be very brief. I have to say that as incoming president, the one thing that you are most aware of are the shoulders that you're standing on, the people that built this organization. And so I really just have to give a great shout out to all the past leaders of the ATA. You have done a great job, and you must be very excited that you've had a chance to see your work be at this level of fulfillment. I also want to echo Yulan's point about the staff and Jonathan Linkus. These are incredibly hardworking people. And I also would ask for a round of applause for Yulan Wang. He has done an incredible job. I think that we all understand that this is a moment for leadership, that the ATA is absolutely at the precipice at a time of change, and we have, as we have just explored, some fundamental obligations when there are larger purposes and transcendent responsibilities at stake. We are dealing with issues that are at the heart of what it means to have an American civilization in the modern world. There is no avoiding the elements and the import of what is on our plate, both as we look at it as members of professions, as we look at it as entrepreneurs and as a trade association. But at the end of the day, we are at the heart of America's transformation in healthcare. When you decide to play in that game, you have got to be very serious about everything that you do. There is a lot at stake, and I'm excited. As we have said, our ATA is on the move. We are growing, and we are shaping the future of healthcare, and these numbers are going to go up this year. We are celebrating throughout this meeting that we are now recognizing that we are mainstream, no longer off to the side, but that we're center core. That is exciting. It means that we can take advantage of new opportunities, of a new marketplace. But what it also means to be center core is that we're going to have to decisively tackle important rate-limiting barriers. What I see my year of stewardship here of the ATA is to be absolutely focused and relentless in my energy around trying to help us to continue the work to knock down the barriers that frustrate or limit the ability of the telehealth to enhance the value delivery in healthcare, and those barriers that limit or frustrate you from operating, growing, and sustaining your businesses. We are going to be relentless on 5 things. And these are things that should be familiar to you. There is really nothing new. Number 1, we are going to continue to enhance access to care for all Americans through telehealth capabilities. We will be focusing on broadband coverage in rural and, yes, as our questioner commented a moment ago, also in urban. We're going to be focusing our energy continuing with the FCC. We're going to work hard to resolve this interstate licensure issue. We have not only continued to work with FSMB, but the National Council of State Boards of Nursing, the Federal Trade Commission, and the Association of State and Provincial Psychology Boards. They may be unusual names for you, but they actually happen to be very important in this dialogue. We want to remove artificial practice barriers, and we want to work to expand Medicare coverage for Medicaid, just as we have done in Medicaid. Number 2, obviously value is the order of the day. And we will be focusing increasingly our efforts on quality, cost effectiveness, and, as we have heard this morning, this notion of the patient being the center of care delivery and their satisfaction with care being preeminent. I am very pleased by our new relationship with the AMA. We have worked hard to establish that because it is important that we work with physicians and advanced health professionals of other disciplines to really integrate telemedicine center core into practice and have them participate more effectively in shaping how this field develops. And so we're pleased about the AMA relationship. We're going to be connecting hospital leaders to the best thinkers and innovators and try to help them to be current with best practices and the best ideas. We will be focusing on disseminating best practices in learning laboratories. We are attracting the energy of the Institute of Medicine, now called the National Academy of Medicine, for learning laboratory forums. We need to be in every place where the leadership in American healthcare is discussing, debating, formulating, and disseminating best ideas. We are not going to be on the periphery anymore. We are center core. And we will make sure that the people that are doing that work are informed by your genius, judgment, and expertise. We have to be very vigilant about best practices so that our field does not duplicate, add costs, but in fact takes costs out and substitutes for ineffective practices. We're going to be advancing the integration of telehealth clinical encounter data with electronic medical record information. You know how important interoperability is. We will continue to work hard with the Office of the National Coordinator, and we will obviously have to be attentive to the issues of data privacy concerns, especially as those frighten and impede consumer engagement. We will be working very hard on developing guidelines. We're so proud of the 14 we have, 6 are in process, and we will find resources to move that development of guidelines even faster. Our accreditation program is critical on the quality side of the house, being able to give patients comfort and confidence that their online consultations are grounded in best practices. And we, of course, will have to work very hard on the regulatory side of the house to make sure that regulatory issues are appropriate, but that we are not treated in an unfair and arbitrary manner in that conversation. We will obviously have to deal with the issue of performance assessment. We know now that the way in which healthcare will be delivered, the way in which it will be reimbursed, and the way in which services will be marketed will be heavily dependent upon evaluations of the quality, cost-effective, and patient satisfaction of outcomes of care. We have to be in that drama. Organizations like the National Quality Forum are going to have to hear from us, and we have to be in that conversation. I'm happy to report that those lines of communication are now wide open, and we will be there. I'm very proud of the ATA's Outcomes Resource Center, which is, I think, going to be a critical opportunity for our association. And I think that this notion of patient satisfaction ought to become one of the major drivers for the adoption of telehealth throughout the delivery system. As the delivery system is evaluated on that three-legged stool of quality, cost effectiveness, but patient satisfaction, we absolutely know that our services, our field, is completely aligned with that satisfaction quotient, and it ought to be one of the major tools advancing us. Number 3, we obviously care about reimbursement. We need to establish a telehealth framework for reimbursement. We are a new thing, not the same old thing. And we need to make sure that we are rewarded for the models that we are bringing forward that are advancing quality, cost effectiveness, and patient-centered care. We have to make the case for the ROI, and that is about research, research, and research. We have partnered with the Academy Health, the major health services research organization in America, and we are saying to the entire family of America's health services researchers, our time has come. You need to be involved with what we are doing and filling the literature with the evidence around best practices, what works, what doesn't work, appropriateness, how do you implement telehealth inside of delivery systems effectively. All of those things are center core for the American healthcare experience, and they are more than worthy of not only the money that supports health services research, but the best intellectual talent in America. And so we are working hard with them. In addition to that, we have to enhance reimbursement by engaging, of course, with the health insurance community, and obviously the new models of delivery care with ACOs, patient-centered medical home, population-based models. All of those provide fertile opportunities, obviously, for us. CPT coding has got to be attended to. It's boring, blocking, and tackling, but at the end of the day, that's the way the game is played. We aren't afraid of boring. We are happy to take that on. And of course, we have to be fearful and attentive to the notions of how our services relate to preventing anything to do with fraud. Fourth, we notice increasingly that our field is becoming essential for the nation's clinical research enterprise. There are new business opportunities and new strategic engagement opportunities for telemedicine to support new ways of conducting clinical research and making it much more robust. I think that this is a business opportunity that many of you in this room will want to take advantage of. For those of you that are in the Institution Council and who are the clinicians in the audience, great opportunities here to partner together and drive the development of new knowledge across healthcare, not just in telehealth. And lastly, your association will communicate relentlessly with every stakeholder to continue to tell our stories, whether it's our customers, physicians, health professionals, consumers, family, caregivers, plans, purchasers, government policy leaders, capital markets. We are going to tell our story. Ladies and gentlemen, there is no question in this time of change, our time has come. Finally, we want to put a couple things on your radar. Please, please, please take advantage of the 10th annual WLSA Convergence Summit, May 26 to 28, down the road in San Diego. We think this is going to be a very important event. Urge you to be there. We absolutely want to see you in the fall forum. Members of ATA, we need you to support not only the summer meeting, but the fall meeting. It is very important to how we operate this association. So if I can plead, beg, pass the hat, anything I can do to ask you, please give us due consideration and join us at the Fall Forum, September 17th in Washington, D.C. It will do you no harm. And finally, save the date for next year in Minneapolis. We are very excited by that. And lastly, we are particularly enthusiastic about our relationship with China. There are a number of people in the audience or at this year's meeting from various parts of the Chinese health system, and we are very excited by the ATA China Fall event in 2015 in Beijing, and we're going to show you a very, very brief commercial, and then Yulan is going to come back and let you go. But as your new president, I once again say to you, I recognize that I am your servant. I work for you. You have got me full head, heart, soul, and mind for the next year. If there are things that we are not doing that you want us to do, that we should be doing, I am very easy to reach, straight through Jonathan Linkus. Thank you all very much. Take care.